Rosacea is a very common problem. A lot of patients who have Anglo-Celtic skin suffer from it. So it's a good idea to ask your doctor if you think you're suffering from it, and often you may not even know it's called rosacea. So we know that people with rosacea get a sensation of burning, of stinging in their skin. Often when they go out in the sun, they notice their skin feels sensitised. Any product they put on their skin may burn and be, a bit red as a result of it. And people notice that in stressful social situations they can flush and blush, and quite a socially debilitating condition really, because people feel embarrassed by it. Some people notice they get pimples or papules across the central part of their nose, and often certain triggers make it worse. So if people notice they're getting red and flushing with red wine, eating hot curries, getting into stressful social situations, they're all symptoms we'd probably think rosacea may be playing a part. It is also common to have a parent or a family history of it, so worth knowing what your family history is in this situation. Good idea to come in and get a consult with one of our aesthetic skin doctors who can talk to you about all the possible triggers. Really important, obviously, to be aware of sunscreen. Now, most rosacea patients actually do not wear sunscreen regularly because they've tried various types of creams. They find they are all sensitive to various, they make the condition worse sometimes. But there's a wide range of sunscreens with different formulations that we can always find the suitable one for a rosacea-prone patient. So the most important trigger for rosacea is daily sun exposure. And obviously living in Australia, that's what we get every day. So my big message for rosacea sufferers is obviously avoid the triggers and get a sunscreen happening every day, and we'll find the right one for you. But book an appointment with our doctors. So what are the symptoms of rosacea? Main symptom is flushing, blushing, feeling burning sort of sensation to your skin when topical products are put on. People might notice a papular sort of appearance on their nose. There's some people's nose at the end stage of rosacea thicken up. There's also some eye irritation that can occur, and people don't realise that about a quarter of patients have eye symptoms with rosacea too. Dry eyes and stinging can be part of it. We know that people can flush and blush in social situations which make them stressed or anxious. So if someone describes that they've always come out of a meeting with a big red face or a red neck, that's probably a symptom of rosacea. The most important symptom though is various triggers that can happen. So sunlight obviously makes it worse. People notice it with drinking red wine. Hot meals like curries can trigger it. But the message we want to get across to people is sunscreen's your best friend when it comes to treating rosacea. The most important thing to do if you feel like you have rosacea is come in and see one of our aesthetic doctors who can book you in for a consult to discuss what's happening, to work out what the triggers are, to work out what's happening in your skin conditioning routine at home, what are the possible products you're putting on your face that may be making it worse, and what we can do to prevent it. And that may range from obviously finding a sunscreen that's suitable for you, through to a range of light therapies that can be offered. Red light therapy we know is very good to soothe and calm the inflammation that occurs in the skin with rosacea. And there are various medical prescription grade products that we use topically to help settle the inflammation. But it's important to understand it's a chronic relapsing remitting condition. So we hope to get most of our patients into a stage where they have gone into a remission phase, and that may take up to 3 months, so people have to be patient. And at that point, they can then usually ease back off a lot of the medications and topical products we prescribe to just using a sunscreen every day.